Next, we'd like to welcome Dr. Gwen Collman, who's Director of the Office of Scientific Coordination, Planning, and Evaluation at the National Institute of Environmental Health Sciences. Dr. Collman holds a PhD in environmental epidemiology, and her role in the NIEHS, providing leadership on the planning and implementation of complex high-priority research programs in many areas of environmental health sciences. She was also the founding director of NIEHS NCI Breast Cancer and Environmental Research, Genes, Environment, and Health Program, in the NIEHS EPA Children's Environmental Health Sciences Program. Please welcome Dr. Collman to the stage.
All right, good morning, everyone. I feel like I need some sunglasses to see you all. It's quite bright here, so sorry for the squinting. But thank you for having me, and thank you so much for starting this conference with the environment. I've waited my whole career to start with environmental health. I'm in a scientific meeting, and so I would say you're one of the first organizations to understand where I come from and where my colleagues in the environmental health field come from. So to start with today, I want to again talk about climate change, and I'll tell you a little bit about how the NIH, which my institute is one of the NIH institutes, is conceptualizing these very important societal, medical, cultural questions of how the climate is changing, how it is impacting all people all over the world, and to give you a little bit of a bird's eye view of the programs that we've developed over the last number of years, and hopefully you'll have the same level of enthusiasm that we do for continuing this. So I've been giving talks about climate change since I started working on this program over 3 years ago, and I've watched the extreme weather events occur all over the country and all over the world. And of course, empathize with people who are involved in this. But it's not until it comes to your backyard, till you truly understand the level of uncertainty, the level of stress, the level of concern that you have for your fellow neighbors for when something like this happens. And so I start with, instead of my global view of these kinds of disasters all over the world, I'm starting with things that are actually in my neighborhood. So this Eastern North Carolina picture in September, I'm sitting in my kitchen looking out the window. A house that I have in Carolina Beach, North Carolina, and I'm experiencing Tropical Cyclone number 8 and the winds and the water and the whipping of this and the flooding to my street and my area. And again, you read about it in the newspaper and you maybe know somebody who's been affected, but till you're in it, man, it doesn't come home at the same level of concern. And then not long after that, in the next month, we had a devastation in the western part. So my two favorite parts of my state, North Carolina, the coast and the mountains, were deeply affected this year by storms, by hurricane. Hurricane Helene affected, of course, Florida and Georgia, South Carolina, and North Carolina. But again, we are still reeling in North Carolina from the effects of Hurricane Helene. So this map here shows you the billion-dollar events that have occurred in the United States just this past year, weather events of every kind that you can think of. When we think about how climate changes, we think about wildfires, we think about hurricanes, we think about cyclones, we think about flooding, we think about all kinds of devastation, and not just in your area. So if you live in a place where there's a wildfire, that's very bad, and of course there's all of the evacuation and the concerns of the recovery issues, but the air that is impacted by the wildfire spreads and travels, and so we saw that a year or two ago with wildfires in Canada impacting New York and the northeastern, and then even again in North Carolina where I live, it was very hazy, and you could smell the smoke that far away. So these things are real. So when we think about at NIH, and of course we're a biomedical research funding and science organization, we think about both the direct effects and the indirect effects of climate and how it impacts us. think about direct effects, which organ systems, which diseases. Again, not just about 5 years ago, we were thinking about how changes in temperature would affect mortality, and most of the data that you saw was about death rates and how mortality was the endpoint that we could measure most efficiently across the world. But we're really thinking about mortality and specific organ system mortality and trying to create discovery around organ systems. And that's where, of course, women's health and all of the organ systems that are involved there is a part and parcel. So here's a list of disease states that are now part of a research agenda at many agencies across the US and across the world. And we are generating more data about these disease outcomes. The indirect effects. Now, this is something that maybe doesn't come to mind when you think about climate. You think about the direct hit of a weather event or of a change in climate or about heat. But then there's all the effects that occur in the environment, in the other parts of the ecosystem that are related to the initial climate driver. So if you live near in Cancer Alley in Louisiana, where there's a lot of petroleum processing, if you live in a place where there are hazardous waste sites in your community landfills, when that flooding comes, that stuff spreads. It gets into the water systems. It spreads through the soil. It becomes more available. The things that were packed away, perhaps and not having exposure to people, now become liberated, and you can get these other effects. It's also true for air pollution, changes in air, water, food quality, and quantity. Well, we just heard a wonderful presentation about food insecurity and food nutrition and all of that. Those are indirect effects of climate, right? Because there's a causal chain here of many, many things that are occurring. Population displacement. If you have drought, if you have flooding, you can't stay there for very long. You need to get the resources that you need to survive, whether it be short-term displacement or long-term displacement. And now, unfortunately, we have many more situations. I think this year is the 20th anniversary of the Katrina storm and the displacement that occurred there. So, those things may be permanent, but they're all social and environmental factors that are very critically important to be generating evidence and learning about. So now think about people who, in your family, who might have chronic health conditions. What happens to them when they're in the middle of a weather event and a disaster? Can you go for your annual screening for, your prevention kinds of services? If you're in treatment for any one of a variety of chronic diseases, what if the hospital or the medical clinic where you're going doesn't have electricity or doesn't have the supply chain of the elements that are needed to help with your treatment? These are really magnified and intensified over and over and over for different parts of the community. And again, not something that I have been thinking about as an environmental scientist. I was always thinking about, well, what causes disease? But what are the impacts of the changing environment on people who have chronic diseases? That I think is a new area and very important. So the infrastructure and supply chain, as I mentioned, either linked to healthcare systems or food systems or any of the other parts of our world that relate to our survival and our thriving. They are all changed dramatically, either with an acute weather event or in the long term with the changing environment and how we have to adapt to that. And then poverty. If you have, are not fortunate to have all of the resources that you need, if you live in a community that's burdened by environmental justice factors like environmental pollution or other things, if you live in a lower middle income country where resources are not available, whether they be financial or others, this climate stuff is a threat multiplier. Right? Your community is not really getting along that well to begin with, and we see enormous health disparities. And then layer over climate, wow, then it just, the impact just grows and grows and grows. So it's important to think about all of these things and how they relate. So as I said, maybe I woke up and realized climate impacts me too this past summer in a way that I didn't think about it before. But of course, we all know that it does affect all of us. And we feel it, and we see it, and we read about it, and we talk to people, and we understand their lived experiences. But everybody's experiences are different, and the climate changes that we talk about here really impact people differently. So just think about these sectors of our population that you can consider to be vulnerable groups, whether they're underserved because of social economic conditions, whether they have already experienced quite a bit of health disparities, whether they be in the women's health arena or in other chronic diseases. How about workers, people who have to work outside? When the temperature is over 100 degrees a day for 30 to 45 days, like in the southwest part of our country here or in other parts of the world, how do you get relief? How are you hydrated? How do you get breaks? You know, you don't have the luxury of choices. You need to go to work every day. And of course, for the sectors that you work in, whether they be agriculture or construction or other things like that, the rest of the community really relies on you to do that job. So we have to think about people like that and how climate factors impact their well-being, their abilities, and the economic products of the work. People with disabilities, again, also may have experienced the impacts of climate, the preparedness, the readiness. How do you need generators, you know, in your homes? Do you have access? Are people who have hearing impairments, or they even have access to the same kind of preparedness information? You know, I think you've probably seen in your own communities sign language interpreters, you know, at the podium with state and government officials now signing out there to make sure that everybody gets the information to be ready, to be able to make the changes, make the decisions when a storm is coming your way. So I think we've seen some nice improvements in that area. Life stage, I'm going to talk a little bit about that because when we talk about women's health, we do talk about the full lifespan, so I'll skip over that for now. I talked about the vulnerabilities with medical conditions, and of course, it's a local problem, but it's a global issue, right? And when we think about strategies for adaptation or mitigation of climate risks, we really need to think about it as a global ecosystem where so many different factors are leveraging each other and playing together. And thinking of it from a very global mindset. So I'm not going to go through all the details here of this because I only have 3 minutes left, and that seems to not be enough time. But I'll keep going. These are the kinds of things that are happening in our environment and related to climate that affect the physiology and the biology of women in ways that are different than how they affect men. And so there's a nice review article here that I've taken this from, but again, put it in the context of when we think about women and we think about women's health, the biology is not the same as if we're thinking about men, if we're thinking about the totality of the population. And I think that is why this session is part of this meeting today, because there are differences. Again, the full spectrum of lifespan, and this nice graphic from a colleague of mine at the NIH in a paper that's been recently published really shows the kinds of disease outcomes or biological states that occur in the life of the woman that we should think about. And as we're trying to understand and quantify the impacts, what are the disease-specific or organ-specific impacts that we have in women? So our initiative, whoa, I got 2 minutes to tell you all about all the things we've done in the last 3 years at the NIH. So anyway, there's lots of stuff to read, and there's a website for you to go to, so I can skip over some of it. But we have a strategic framework. We have 12 institutes that are actively part of our initiative. It's really different. This used to be only an environmental issue, right? We didn't think about people in the different medical disciplines or the other institutes caring about this, and over the years, we've changed that at the NIH. And for those of you who know about how programs develop at the NIH, this is really important and impressive to have other directors who are really, you know, with us every month working on this. This little cog diagram here is sort of the centerpiece of how we think about the program. What we think about is who should be at the table, what kind of scientists, and who should those scientists be working? Because NIH is in the business of generating evidence for science, for discovery, for understanding, and now for action. And so it's not okay to just be in your own little silo. This is not a problem that can be solved by just one discipline. And we very much prioritize working with communities and people who are impacted by climate factors, by climate situations, and we require these partnerships in our research program. We hope that that would allow the co-creation of research aims, of the carrying out of research, increase literacy across the board, and then move the information that we get from this research into the hands of people who can really use it in very proactive ways. Okay, so new programs. These are two of our research centers that were funded this last September that really focus in the women's health arena. So you can learn more about those on our website. We have brought together these teams across the disciplines, with community, with translational partners, and we just made a big award, $30 million of these centers, for them to work together for about 3 years to sort of gel, to start doing the work, to create opportunities, and to really focus on solutions. So this is just a landscape of the different places we're working, the different areas, the kinds of activities and actions that are now in the works in the US. And we also have partners in other parts of the world for some of these. They have a health equity focus. So again, if we're creating solutions, if we're develop evidence for solutions to be implemented at a local level, these need to be just solutions. They need to be solutions for everybody and created in a way that allows people to adopt them and use them and make sure that everybody benefits from them. And then there are some of these that have an international focus, and so again, as I said, it's a global problem, and we're trying to create these same kind of opportunities for evidence because we know that there are government leaders in many countries that are really looking for local evidence in order to implement policies and change. I got 37 seconds left. Okay, so we have a coordinating center activity. We're creating a community of practice for our research community, and we're going to have a conference in March that you're all invited to. Please go to our website and look for this. Anybody is welcome to join, and there are a variety of resources available to the community. We have an award program with the National Science Foundation for rapid response to weather-related disasters and to get the research going quickly in the field, sort of right after the recovery phase, which is very critically important. And we have some products available. So we have a literature portal, we have a glossary, and we have a disaster response program that has pre-approved protocols for this kind of research to occur anywhere in the US or around the world. And here I am, and I guess I'm over. But anyway, I'm at the end. So these are the current research opportunities that are available. With the QR code, you can get to the announcements. I'd be happy to talk to any of you about your ideas for research and give you, connections across the NIH. And I thank you very much for your attention, and thanks for having me today.